Good afternoon. This is Dr. McDaniel at GYN Corner, and I'm coming from Calais, France, right now. We left the train, and I'm on a bus to go across, or actually it's to go under the English Channel. We're going through the channel. I'm speaking from the bus because when we had our break in Paris, I was distracted. We were eating breakfast. I forgot to do the presentation. And then on the train, I really can't do the presentation. It's just too much. I don't know, the vibrations or something makes it bizarre. Can't hear anything. The auditory portion is horrible. So we are going to be crossing the English Channel. I'm taping still. I have zero internet access. So I'm continuing the information on the Pap screening. And I previously gave information about prevention of cervical cancer is by two means. The first line of defense is the vaccine. Gardasil 9 covers 7 of the 14 high-risk strains of HPV. These are the windmills for energy. Covers 7 of the 14 strains. And then the second line of defense is the Pap screen, Papa Smear.
You had to hold your urine too long and you start getting bladder problems.
Yeah, but she said it moves on you quick, so as soon as you got in there, we started taking off.
Yeah. No, I was in there for a little bit. I just had to get out of my
Sorry, I get distracted.
Somebody came knocking on the door.
So the second line is the Pap screen, and that's the evaluation to see if there are any irregularities seen on the cervix that indicate that precancerous changes have taken place, and that cervical cancer is imminent if no intervention is made. So the Pap screen So the Pap screen is invented by Dr. Papanicolaou, and it's a way of exfoliating the cervix and then evaluating those cells to see if there are cancerous or precancerous changes present at that time. Now, I'm just going to cut in. Of course, this battery is weak, so I may have to do this in two parts because my cell phone right now is on low cell. And of course I don't have the power charger. It's in my bag underneath the bus, but oh well. I'll do the second half as soon as I can, maybe in two parts. So the exfoliation of the cervix, and I mentioned previously that it can be evaluated with a conventional Pap or a liquid Pap. I don't know that many places still use a conventional Pap smear because of the difficulties inherent with giving a high rate of correct evaluation. So, because the Pap smear is a screening test, it has a believable rate and a non-believable rate. So, screening tests are always ways to just take the majority of people and put them in the correct group to nix them off, say they're at a low risk for the problem we're looking at, or to tick them off and put them into a group that needs further evaluation, because they're at a potentially high risk for what we're looking for. So the screening tests always have what we call a true versus a false, negative or positive, where negative is normal, positive is abnormal, and true is 100% believable. So whatever it said was going on, in hindsight, it's spot on, absolutely accurate for what it said was going on. And that true believable rate for the conventional Pap smear is between 55 and 65%. So 55 to 65% of the time when people are told their Pap is normal or abnormal, that's exactly what's going on. Unfortunately, there is that false rate because we're always going to have a few people fall through the cracks. Either the abnormal cells never made it to the slide to be evaluated, or they made it to the slide and they weren't identified, or there are environmental factors, so red blood cells, white blood cells, inflammatory changes, mucus, debris, yada yada yada, and those can obscure and make the evaluation difficult, so we're going to get a false abnormal rate. And that false rate, false normal or false abnormal rate, someone being told their Pap is normal when it's actually not normal, or someone being told when their Pap is abnormal and it's actually normal, that false rate is between 35 and 45%. So 35 to 45% of the time when people are told their Pap is normal, it's not actually normal. Now, the liquid Pap smear was invented to decrease predominantly that false abnormal rate, or the false normal rate, the false negative, because realistically speaking, most people aren't going to be angry if you tell them they have a problem. You do further investigation, evaluation, and yay, you're fine, it's an overcall. But they will be upset if you tell them they're normal, and then down the line, oh, sorry, you slipped through the cracks, you actually weren't normal. So the work has all been focused on decreasing the false normal rate, or that false negative rate, and we have been able to do that with the liquid Pap smear. So with the liquid Pap smear, the exfoliation is obtained through the spatula and the brush. With the spatula and the brush, a very thin film, 1 cell layer deep of cervical cells is spread out on the slide for microscopic evaluation, and the believable rate, or the true normal, true abnormal, true negative, true positive rate, goes from 55 to 65, all the way up to 85, even 95% believability in some studies. And more importantly, the abnormal rate drops from a false normal, false abnormal, or a false negative, false positive rate of 35 to 45%, drops all the way down to 5 to 15%, which is a huge improvement. The nature of the beast of screening tests is we will always have a false rate, but 5 to 15% is pretty small. And the second, so that's the primary advantage, that the cells are more readily available for complete evaluation. The second advantage of the liquid Pap smear is that the Pap juice that's left over after the cells have been obtained can be used for a culture to check for the presence or the absence of the virus, which is human papillomavirus, or HPV, which is the source of cervical cancer. So 99% of cervical cancers are due to human papillomavirus. There are over 180 strains of HPV, and 14 of those strains have been identified as what we call a high-risk strain. So if left to their own devices, they are the most likely to cause severe precancer and or very early cancer of the lower female genital tract, so the cervix, the vagina, and the vulva, within 1 to 3 years. There are other strains of HPV that can cause cervical cancer, but they mosey along to that. They take much longer, 10 years, 12 years, 15 years even, to cause severe precancer and cancer changes. But the 14 high-risk strains are more rapidly going to produce those changes. And the most aggressive of the HPV strains are 3, the 16, 18, and the 45. The 16, 18, and the 45 are responsible for over 70% of the world's cervical cancer, so they're quite aggressive, and changes that could potentially take one of the other 14 2 to 3 years to produce can take the 16, 18, and the 45 less than a year to produce, so they are quite aggressive. When the liquid Pap smear is done with the cervical cell evaluation and then the culture to follow that, we call that a co-test. So co-testing has been recommended for everyone who is 30 years old or over. And that's because the research has shown that 80% of women, or young women, who are under 24, and it peters up through 26, 80% of young women who happen to have the virus, any of the HPV strains, their body's immune system will be able to eradicate the virus from their system within 2 years of infection. Of course, no one knows when the 2-year clock starts. No one knows who's going to be in the 100% keep or if they're going to be re-exposed, but the general gestalt, the overall take-home message is that the bulk of young women will not have the virus active long enough in order to go to cervical cancer. So the co-testing is not recommended for young women. It's everyone over 26, and to make an arbitrary set line where everyone's going to be in the same boat, the age of 30 was picked. Now I will go into more detail on that and continue the discussion on the Pap Smear tomorrow. So this is Dr. McDaniel at GYN Corner Facebook, and then we also have the GYN Corner on YouTube. Today is, what is today? Today is Thursday the I'm losing my days because I'm not working. 27th. Hope everyone's had a great day and a good rest of